Hi, my name is Joseph Landsman. I'm a scientist in Dr. Duke Dong's Organogenesis Laboratory at Sanford Burnham Prebys Medical Discovery Institute in La Jolla, California. Our lab recently discovered a way to reprogram cells to change their identity to become a completely unrelated cell type without having to remove them from the body. We believe this breakthrough will have great implications for people with degenerative diseases like diabetes. Ultimately, it may allow us to generate new replacement beta cells directly in people with diabetes, bypassing the need for immunosuppressants or encapsulation devices. As we know, people with diabetes do not have enough insulin-producing beta cells to stay alive without constant blood sugar monitoring and insulin injections. Therefore, a cure for type 1 diabetes will require replacement of the beta cells lost in this disease. Based on previous research, it is well established that donor beta cells can be transplanted into other tissues in the body and function effectively in people with type 1 diabetes and in animal models. But the major obstacle to this promising therapy is that there are not enough donor beta cells to treat the millions of people with diabetes. To address the donor beta cell shortage, the prevailing strategy is to manipulate stem cells into beta cells and implant them into a diabetic patient. However, it's the very nature of stem cells being expandable and malleable that puts these cells at risk of becoming tumorigenic and therefore inherently unsafe. Our lab is focused on an alternative approach for generating replacement cells. We aim to convert other cells in a patient's body into beta cells without having to remove them, a process called in vivo cell lineage reprogramming. The term in vivo refers to cells remaining in their natural environment. The critical advantage of reprogramming cells while they remain in a patient's body is that it would circumvent the need for invasive surgeries and the use of potentially harmful cultured cells. Based on our new theory on cell lineage regulation, we are now, for the first time, able to reprogram cells in vivo into completely unrelated cell types. Importantly, we can reprogram muscle and skin cells to become a naive class of cells that would normally give rise to tissues such as the pancreas, where beta cells normally develop. Our novel reprogramming strategy utilizes a few key DNA regulatory proteins that can effectively hack into the muscle cell's genome to turn off the muscle cell program while turning on the beta cell precursor program instead. Our vision is to reprogram a small subset of cells into beta cells from select non-vital tissues throughout the body without disrupting the normal functions of that tissue. Our most urgent objective is to further guide our in vivo-induced naive cells into functional beta cells. With your support, we will be able to accelerate our proof of concept studies to determine the feasibility of using in vivo cell lineage reprogramming to generate a vast new supply of replacement beta cells.